And good morning. Welcome to Community Voice. It is Friday, January 29th. I'm your host, Josh Engel. Today in the studio, we have Andrew Mills, the CEO of an exciting new enterprise right here in Carrollton, Georgia, known as CareTrack. I think we'll just let Andrew handle discussing the organization. It's a bit more complex than that I'm just going to throw out here. But Andrew, good morning. How are you?
Hey, good morning. Thank you for having me.
Hey, thank you for joining us today. Just want to let the listeners know that we are on Facebook Live today on the WLBB Facebook. So if you have any questions for Andrew Mills, the CEO of CareTrack, feel free to hop on the Facebook and leave your questions there. We already have some comments. Excited to hear what CEO Andrew Mills has to say about CareTrack. So I guess the word's out. First and foremost, let's just talk a bit about you. Let's talk a bit about your history and what brought you to this point in your life.
Oh, sure. Well, so I graduated from Mercer University and had a number of entrepreneurial businesses. I've worked for myself, I guess, most of my career. And prior to CareTrack in Carrollton, I worked for Greenway Health, a local company that did electronic medical records. It was a great company, a super environment. I was very fortunate to work there and saw an opportunity inside the current market space that we're operating at CareTrack, and went out with other former Greenway employees and started a company to service that market inside of a new program that Medicare started in 2015. So we started CareTrack in 2015, and we've been hard at it ever since.
Excellent. So, and you currently live in the Carrollton area, correct?
I do. I live in Carrollton. I've lived in Carrollton 16 years. I have 4 kids. They attend the school system. Love the community. It's been a wonderful place to live.
Excellent. It is a great community. Truly is. So let's expound on what CareTrack does, because it is, it's a great idea, especially given the current climate the last year or so. Tell us a bit about what CareTrack provides to our listeners here.
Oh, sure. So CareTrack is a healthcare company. We're headquartered in Carrollton. We provide services to physicians and their Medicare patients. The Medicare patients are typically patients that have recently been discharged or let go from the hospital and returned home, or patients that have chronic medical conditions. And a type of medical condition would be diabetes, heart failure, pulmonary disease, those type of medical conditions.
Something chronic and ongoing.
Yeah, chronic and ongoing. And so we do... Our solution provides a continuous support for those patients in between their office visits with their physicians, and we do that remotely. And the way we do it remotely is we operate as an extension of the medical practice. So we employ medical professionals, nurses, medical assistants that use a software platform that we developed to provide that continuous care in between their regularly scheduled office visits. And what we do is we cover things that help them stay on track with their medical plan that's established by their physician. And it has a big impact on outcomes, positive health outcomes, make sure they're staying adherent to their care plan, and it reduces the ER visits and hospitalizations.
Excellent. Now, this is in the age of COVID. Telehealth has become very popular. Is this comparable to telehealth in that, it's remote like that?
Yeah, it's in the telehealth sphere. Telehealth, per se, is a replacement for an in-office visit. So you go to your doctor and you sit in the exam room and you talk to your physician. Telehealth is just a replacement for that, by and large. We refer to our service as telecare, which is a much broader continuous monitoring of patients remotely. So what we've seen is that your car never breaks in front of the mechanic. Acute exacerbation of conditions usually happens at home or away from a physician's office. And so we're able to touch patients on a more regular basis to gather information both via conversations or via medical devices that provide feedback to the physician and allow them to adjust the care plan and react to those patients' conditions on a more timely basis.
So the CareTrack team, they could be tuning in on this person's vitals, for example. They could be watching that, and they could have that data accessible to them, and it can make changes and decisions based on that data.
Yeah, that's correct. So we do ship medical devices, vital devices to patients that have a communication capability. So a blood pressure cuff or a glucometer or a pulse oximeter. So that data is flowing back to the physician, and then when it's out of range, we can react to it with our care team and inform the physician of how best to treat that patient or what the next step is.
Providing intermediary care between appointments.
Yes, that's what we do.
Do we think this could limit the number of appointments that someone would have to leave their house, physically leave their house and go to the doctor?
We don't really see it as a replacement for appointments. Now, given the pandemic, there's been a sharp decrease of the number of patients that are going to see their physician that are in this segment because they're the most vulnerable to COVID, but not really. It's the intermediate visits with patients typically happens 3 to 4 times a year, sometimes more, with patients that have chronic diseases. So they're pretty regularly keeping in touch and seeing their physician. So this augments what the physician is already doing and what the physician's practice is already doing to give them more information to help those patients.
Why is this such good news for West Georgia residents?
Well, we employ a number of folks in West Georgia. Currently have 44 employees, and we're continuing to grow at a pretty rapid clip. We're always looking for nurses and medical assistants that may be interested in a different work environment. And we offer benefits. We do have clients in West Georgia. Typically, patients don't know who we are because we work as a part of the practice. I think we just continue to develop the community, and we're a value add for West Georgia.
For sure, without a doubt, especially considering the stats of overall the age of our country at large, which I know that we'll be going into in a bit more depth here later. But I mean, there's never been a more important time to have a service like this available, essentially.
Yeah, it really is. Medicare's facing a crisis, essentially. In general, the world population is getting older. There's a statistic I saw the other day. It was in 2019. We crossed a threshold for the first time in human history where the number of people that are 65 years or older outnumbered the number of people that were 5 years or younger. So what that means is generally worldwide, the population's getting older. In most developing countries, it's happening faster. In the United States, it's no different. So the number of people that are turning 65 every day in the United States is about 10,000. All those people move on to Medicare as an insured base, as an insurer for the most part, Medicare Advantage. So you combine that with the chronic disease rate in the United States, it's not getting better, it's getting worse. For example, diabetes used to be 1 in 15. Now it's close to 1 in 7. It's predicted to go to 1 in 3. So we're getting older, we're getting sicker, and 97% of all Medicare costs right now go to patients that have 2 or more chronic diseases. So all of a sudden we're going to go from 60 million Medicare patients to 80 million Medicare patients in 2030. That's going to put a big burden on the Medicare. And so that's something we have to figure out as a society. And so one of the areas where we help support that is to keep patients on a care plan so that they stay healthier. If we can keep those patients stay healthier, ultimately it costs less money. And as a society, we're going to have to figure something out because those statistics don't work in our favor.
We're going to take our first break, but when we come back, we're going to continue our conversation with Andrew Mills, the CEO of CareTrack, an exciting new enterprise right here in West Georgia that is going to be giving further assistance to Medicare patients throughout the area and beyond. So stay with us.
At Oak Mountain Academy, our daily schedule includes convocation, prayer, and the Pledge of Allegiance. By doing so, we build a family-like community where all students grow and flourish and personal faith is encouraged. Through community service and a historical approach to biblical study, our students are taught the value of the warrior way, honesty, respect, and responsibility. Oak Mountain Academy, we are a family creating legacies. To learn more, visit oakmountain.us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. #WeAreTannerStrong. That's tanner.org. #WeAreTannerStrong.
And we're back to Community Voice. I am your host, Josh Engel. It is Friday, January 29th. We have Andrew Mills, the CEO of CareTrack, in the studio today. If you're just tuning in, be sure to check out the Facebook live stream, which is going on right now over on our WLBB Facebook page. If you have any questions for Andrew Mills, feel free to leave them there, and we can ask him on air right now. So we're talking about CareTrack, if you will, for listeners that are just now tuning in. If you will, sort of give folks a sort of a brief idea of what CareTrack is aiming to do.
Sure. So CareTrack is a healthcare company in West Georgia. We support physicians and physician practices to help patients stay on track between their regularly scheduled office visits. And we're particularly focused on Medicare patients, which are typically elderly patients that have chronic diseases that are susceptible to being admitted to the hospital.
Now, why is it so important that individuals like these older patients with chronic illnesses, why is it so important that they have ongoing care like this?
Especially in the pandemic, they're the most vulnerable population. But the adherence to medications, as simple as that is a third of the driver for hospitalizations for patients in this demographic. Meaning, if these patients don't take their medications properly, they have a good chance of getting admitted into the hospital. Well, keeping track of your medications, if you have chronic diseases, your number of medications increase and it becomes more complex. So the ability to help those patients keep those medications and take those medications properly is a big deal. So that's one area that we help support patients to keep them healthier.
So we have a question here on the Facebook live stream. It says, I have a doctor in my family. Is it expensive for his practice to possibly implement something like CareTrack?
So no, actually it isn't, because Medicare reimburses for this type of service. So the service that we provide is directly reimbursed to the physician by Medicare. So Medicare pays for it. But what we've seen is that inside of primary care, which is our most of the physicians we serve are primary care physicians, that they don't have the staff or the resources to be able to provide this service for a large number of patients. So what in turn happens for the physician with a company like ours is they're able to provide this service, keep patients healthier, and they actually make a significant amount of revenue for it. So it's actually a profit center for the physician rather than a cost. So it's really a win-win-win for the physician and the patient and the insurance company in this case is Medicare, because patients stay out of the hospital and don't incur additional costs from additional medical care because they've run into a problem. And that's really why they devised the program to begin with. Medicare did. So it's a win-win-win, and the practice actually makes money from it.
Well, you've mentioned the pandemic. Well, it's hard not to mention the pandemic nowadays. But how has that impacted your company, particularly its relevance?
Sure, it's impacted in two ways. The first way is the impact to the patient, right? Because these are elderly patients that have chronic diseases that we care for the most. They're at the epicenter of the pandemic. They are the most susceptible to catching COVID and having something go bad because of it. And so those patients, because of being because those patients social distance, they haven't been going to see their physician. So we've seen, surprisingly enough, inside of primary care, the number of office visits that a primary care practice was significantly reduced during the pandemic. So the patients that needed care the most to maintain their chronic conditions weren't going to see the physician, and that had a number of impacts, both from the level of care that patients received, as well as the ability for those practices to produce revenue. So the people that are most needed during the pandemic to support the patients that need it the most were the most impacted by the pandemic.
That's a lose-lose.
Oh yeah, so it's for a service like ours where we're able to gather additional information remotely and bring that back to the physician. It's a huge benefit for both the care of the patient and the physician.
So you mentioned, you are housed here in West Georgia, and you have, I think you mentioned 44 employees currently.
Yes, 44.
So are you currently accepting applications?
Oh, yes.
And what sort of positions are you looking to fill? Because you're wanting to expand the level of service and the amount of folks that you can serve. What are you looking for currently?
So we have a need for nurses and medical assistants. We're hiring those constantly. And we also have a software development group, a research and development group. And then we need general support staff. And all those are listed on our website under our careers page. We have a number of open positions right now. West Georgia has been a great place to source employees, especially in the medical areas, nurses and medical assistants. So we've been really fortunate to have just an incredible group of people that we've assembled.
Have you had some former peers from Greenway making their trek to CareTrack?
We have a few.
I had a feeling they want to try to recapture that brand, that feeling of working for Greenway there. Something all new and exciting. So, how long have we been doing this now? So, did you start forming the company right around the time of the pandemic? Because that has to at least provide some challenges.
Yeah. So, no, we founded the company in May of 2015. We had our first serviceable patient, which we produced revenue for in June of 15. And we've been hard at it ever since. And what we realized was that our prior electronic health record experience with Greenway allowed us a technical capability that other companies in our space we haven't seen. Let's just put it that way. And so we're able to consume health record information, historical information about the patient that a physician charts, and combine that into a care plan that can be consumed by the patient so it's easily understood. And that ability has given us a competitive advantage in our space, but also made us extremely efficient as a company to provide better outcomes for patients.
So if a patient, for example, because I'm trying to look at it from the perspective of a patient. So if a patient were to be a part of this program, and they were to have questions, let's say they might, they're confused, there's a lot of medication they're taking, there's a lot of things. How would they go about reaching out to CareTrack? And would it provide quicker service as opposed to trying to reach out to their primary care physician?
It depends on the practice, but typically, yes. So we're viewed as a concierge service within the practice, and we're available 24 hours, 7 days a week. So at 7 o'clock on a Friday evening, they realize they're out of a medication, they can call us, and we can get that information over to the physician to get that filled. Or if they run into a medical question, they can call us at any point, And then additionally, we reach out to patients that we're in contact with if we see some information that would raise the level of concern, or we may have additional questions. And then we touch base on a periodic basis with patients to make sure they understand exactly what the physician had told them about their care plan. And we provide them a care plan per se too.
Certainly.
So they get a written document that includes all the instructions that the physician has compiled for them.
So you're making it as easy as possible for these patients, the ones that are at most at risk, to be safely taken care of and to have all the information they need on hand.
Yeah, we do. And it's amazing the feedback that we get every day from patients that appreciate our coordination team reaching out to them. And there's real rapport because it's a regular communication that happens multiple times a month. And so typically they're on a first name basis with patients. And so the rapport that's built up and the trust and the understanding about how we're caring for patients has been really rewarding.
Well, we're going to take our second break, but when we come back, we're going to continue our conversations with Andrew Mills, the CEO of CareTrack. We're going to be talking about the future of CareTrack and their goals moving forward. So stay with us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. Hashtag We Are Tanner Strong. That's tanner.org. Hashtag We Are Tanner Strong.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. Our pre-K 3 through 12th grade environment offers a family-oriented atmosphere. We are an independent school with faith-based values and an academy honor code. Our academic standards prepare our students for college and beyond. I'm Patrick Duran, headmaster, inviting you to visit us on the mountain or at oakmountain.us. Come see how our warriors are creating legacies.
And we're back to Community Voice. It's Friday, January 29th. I'm your host, Josh Engel. We have Andrew Mills, the CEO of CareTrack, in the studio here today. We've had a very interesting conversation. If you're just tuning in, be sure to go check out the live stream on our Facebook live stream over at the WLBB Facebook page. And if you have any questions, any last-minute questions here for Mr. Mills, feel free to throw them on the live stream. Type that comment in, and I will ask it to him before we wrap up. So we touched a bit. The pandemic, it very much correlates with the importance of the work that you guys are doing, especially right now. Not that it's required to help the lives of patients, but it's certainly making it all the more effective right now. But just from a company standpoint, I mean, this was an entrepreneurial endeavor. How would we say the pandemic necessarily has affected the company from the logistical standpoint?
Yeah, so we were watching. So when we first heard of COVID-19, it was in January. Started watching it because the ears perked up when we first heard the reports coming out of China. So we started running tests for remote work environment. And so we began to increase those tests over time. And then I remember it was March 15th, it was a weekend, we started getting reports that Atlanta Medical Center, Emory, Northside were starting to see COVID cases. And it was really surprising because we didn't expect it to just pop up, flare up all of a sudden. So we made the decision on Sunday. Monday morning, we were remote. So if you didn't have your stuff, you came into the office and you got it and you went home. And we've been remote ever since. And one of the interesting things about it is we had some presuppositions that we believed we needed a call center that had every person that worked for us inside that call center, inside a centralized room. And what we realized was we didn't necessarily need that real estate space. And so we didn't miss a beat with going remote. And so effectively right now, the company is almost exclusively on a remote basis. And all of our infrastructure is cloud-based computing. So it's secure in the cloud. We can do work really from anywhere. So surprisingly enough, it gave us more flexibility being in a remote environment than we otherwise would have operated under, thinking we needed to be in a centralized location for the whole company. Now on the market side, the demand for our product has increased because patients aren't coming in to see their physicians. So that's put a greater demand for our product. So is the pandemic has been terrible, but the impact to our company is seen that we can help support physicians during the pandemic because they're not able to come in and see them as regularly.
We had a question come in on here on the live stream from Brian. Brian Prokes, he says that my grandmother has diabetes and sometimes forgets her medication. She is not in a dangerous situation now, but she could be. How can she get CareTrack? Should she ask her doctor?
Yes, she should ask her doctor. So we work with the physician, so we have to establish a relationship with the physician practice before we serve any given patient. But yes, please have her ask her physician about CareTrack. That'd be great.
Excellent. So we have about 3 minutes there, 3 minutes left here. Real quick, what do you see for the future of CareTrack, and where can folks find more information?
Well, we have a website, CareTrack.com. We've really expanded our social media presence, so we're on Facebook and Twitter, LinkedIn. Yeah, the future is quite bright, actually. So right now we're just scratching the surface as far as the potential market for us. There are close to 57 million Medicare patients right now that can use our service. We have around 300,000 Medicare patients under contract, and we're expanding our market presence every day. So we see extensive growth in the next 2 to 5 years. And I think that's going to have a big impact on West Georgia, and we look forward to just continuing to employ people here in West Georgia and expanding our operations.
And one more time, in the time we have left, what sort of positions are you looking for, and where can they apply?
Yeah, so we're looking for nurses and medical assistants, as well as other support staff related to sales and technological development. And you can visit our website at caretrack.com/careers.
Excellent. Well, Andrew, it's very much it's been a pleasure to get to chat with you today, and I'm very excited to see what happens with CareTrack moving forward. Any final words?
No, just thank West Georgia, and thank WLBB for what you do for the community.
Well, thank you. That means a lot to us.
Yeah,
thank you for joining us.
Yeah, thank you for having me.
Excellent, and thank you for tuning in. We'll see you next time.